Hi all, myself Dr. Dhruvin Shah. I'm a consultant gastroenterologist based at Surat, Gujarat, and I'm practicing in Swasthyam Gastro and Liver Hospital. See, there are a number of procedures. If I have to name one, then I would say transarterial chemoembolization. It is a procedure in which a person who has a cancer in the liver, if it is of a size of around 4 to 5 centimeters, then there are methods, a minimally invasive method by which this cancer can be totally cured. These procedures are done by an interventional radiology specialist. Yeah, definitely. I think that the trend is changing nowadays with people and also our patients opting for minimally invasive and lesser scarred procedures. If he can have an option of not opening up his abdomen, and if a procedure can be done by simply putting a small needle or a small syringe inside his body, definitely then they will opt for that. Definitely, yeah. Younger patients, they definitely want to go back to their routine, to their lifestyle faster, so they do come to my OPD and demand for a scar-free or an alternative to a surgical procedure in which they can return back to their routine as early as possible. It's a very interesting question. As you can see that today's era is highly dominated by artificial intelligence or AI. So what I believe the future for IR holds is there might be a mapping of the entire body or mapping of particular organs per se, like liver, so that based on AI we can have a very detailed descriptive anatomy of the region, and so that we can very specifically target the lesion areas, so that it would be a boon to the medical practice in the coming IR field. It is a great question, because in today's era, IR truly is complementing the GI physicians and GI surgeons. There are few conditions in which a gastroenterologist or gastrophysician or gastrosurgeon may not be able to help the patient much, but an IR specialist might come in and save the day for the patient. So definitely they are truly complementing each other.